Talk Family Health with Dr. Elizabeth Vaughan. We have folks on the line, so let's go ahead and get to the phone calls. Judy, good morning. What's your question?
Good morning. I am 47 years old, and I'm having severe night sweats for several years now, but because of a pseudoaneurysm in my right carotid artery, I've been told I'm not a candidate for hormone replacement therapy. So what can I do to reduce these symptoms I'm having?
Well, you may not be a candidate for estrogen replacement therapy, but you certainly are a candidate for natural progesterone. And you could try using some of the over-the-counter Progest, which is a very good quality USP progesterone. You could try using that on a cyclic basis, applying it to your skin 21 days on and 7 days off, or 25 days on and 5 days off. That might well help with the night sweats. Also using some 5-HTP, which will raise your serotonin, or some of the antidepressants that help raise your serotonin. All of those things will help.
Let's go to Laura in Greensboro. Good morning, Laura.
Good morning.
Good morning.
I'm 62 years old, and I'm taking Prometrium, 200 milligrams, progesterone, micronized, and I'm taking Trias, 1.25 milligrams, a capsule, estradiol. I'm 62 years old. Are these safe?
Yes, they are safe. What you described is Triest, and one component of that is going to be estradiol, but there are also going to be some estrone and some estriol that I was talking about in the earlier segment that is actually the anti-cancer estrogen. Those are perfectly safe. Some people, I prefer putting women on topical estrogens because that delivers the estrogen directly to your bloodstream as opposed to swallowing them, but some women can't tolerate that or they just don't work. So taking the natural estrogen orally is fine, as is taking natural progesterone orally.
Let's go to Beverly in Trinity. Good morning, Beverly.
Morning.
Good morning.
I'm 50 years old, and I just had a total hysterectomy.
Congratulations.
Nightmare.
Not really.
I was wanting to know what would be the best replacement hormones that I could take instead of, the synthetic.
Well, did your doctor take out your ovaries also?
Yes.
All right. Then a conventionally trained doctor is going to say all that you need is estrogen, and they may give you a Vibel Dot or a Divigel, one of those new estrogen, one of the estrogen products where the estradiol goes through your skin. That's perfectly okay. I would argue, and physicians who have been trained the way I have would argue, that every other cell in your body also has receptors for progesterone. So I would have you cycle off and on the estrogen, preferably cream forms of estrogen, oral or cream forms of natural progesterone, going off and on them every 25 days. So on for 25 days and off for 25 days, because your brain needs the progesterone and the estrogen. Your heart needs the estrogen and the progesterone. The progesterone actually helps work as an anti-estrogen and reduces your risk of cancer from any estrogen you take.
All right, let's go to Kim in Archdale. Good morning, Kim.
Good morning.
Good morning.
And I'm going through menopause, and I had a blood clot about 4 years ago, and I want to know what I can take safely to get me through.
That's a little bit tricky, but the bottom line is that topical estrogens do not really increase your risk of getting blood clots. The oral estrogens do, whether it's a birth control pill or Premarin or Estrace, or even Triest or Biest, which are some of the bioidentical compounded products. Any oral estrogen is going to increase your risk to get another blood clot. I would suggest that you talk with your doctor and talk about using a very, very low dose of a topical estrogen, whether it's a part of a patch or a cream.
All right, let's go to Annette in Winston-Salem, our final caller. Good morning, Annette.
Good morning.
Good morning.
I was having my period 2 and 3 times a month, and I went to my doctor, and he's requesting hormone therapy. What kind of hormone therapy do you recommend?
Well, I'm not certain what he suggested. It may have been birth control pills, or it may have been Provera, which is medroxyprogesterone acetate, which is a progestin, a drug that I don't like, or natural progesterone in the form of Prometrium, which is a bioidentical oral natural progesterone. My choice would probably be the oral natural progesterone, and you could take it on a cyclic basis from the 15th day after the first day of your period to the 26th day, and that should help straighten it out for you. Sometimes you'll need a kiss of estrogen along the way also, but I would try the oral progesterone first. So Prometrium, 100, 200, maybe even 400 milligrams for 12 days a month, days 15 through 26 of your cycle.
All right, our time's up. Thanks so much for being with us.
Thank you so much.
Naturaltriad.com if you need more information.
That's right.
All right.